When patients come to see me for body contouring after a massive weight loss, they're often in much better shape than before they lost weight. If they lost the weight without bariatric surgery or with bariatric surgery, they were much higher risk at that time. So if someone has managed to lose weight, to change their life, to eat better, to exercise, they are a much lower anesthesia risk than they were before. Quite simply, they're just healthier people. Common questions that I'm asked about this operation are, what can go wrong? And those are very valid questions. There are things that are significant that can go wrong, which happen very infrequently. And then there are things that can go wrong that are not as dangerous, but can be just a bit of an inconvenience. The biggest risk of any major body contouring operation is a pulmonary embolus. And that's where someone can get a blood clot in their legs, and if that blood clot gets free and goes to their lungs, it can be very serious and sometimes fatal. We take every precaution to prevent that eventuality. It's very important that the surgery be done meticulously in an efficient way, because we know that by reducing the time in the OR, we can reduce the risk of having these untoward events, such as a pulmonary embolus. The other thing we do is, after the surgery, is that we get you up and walking around. So if we can get you out of bed and control your pain, you have less chance of having something like a blood clot in the leg or a blood clot getting free and going to your lungs. We take every precaution during the surgery to reduce the risk of a DVT. It's standard now to use compression devices on the legs to improve the circulation back to the heart during the surgery. In some select cases, if somebody has a predisposition for clotting, we will use anticoagulation after the surgery. That's not typically done for most patients, but if we recognize that there is a risk, we can give you something after the surgery to reduce the chances of a DVT. There are things that can happen after a lower body lift that are not significant in the sense that they're not dangerous, but they can delay your recovery. Some patients will have what we call a seroma, which is a collection of fluid underneath the skin, and that typically takes a few weeks to resolve. So if you have that, you may come back to my office and we can put a little needle in and aspirate the fluid, but over time they go away on their own. Infection after lower body lift is uncommon, but if you did have that, you may require some antibiotics. In very rare cases, you may have an abscess that requires drainage. That's typically stuff that we can do in the office. In more unusual cases, we would have to go back to the OR and drain that.